Let's get going.
Good. Well, we might as well get going. Good morning and welcome to everybody both here at Sick Kids and on WebEx to this first regional session hosted by RISE for individuals interested in supporting Ontario health teams. It's an exciting time in our province and we're glad to host this event today. I really do want to thank our hosts here at Sick Kids and welcome those joining by WebEx. My name is Rob Reed, and I'm one of the co-leads of RISE, together with my colleagues John Lavis and Jeremy Grimshaw. And we have a few minutes with you this morning in this learning session to talk through RISE and the supportive platform that we have been building over the last couple of months. This is the agenda for today, and we're going to spend first a little bit of time introducing ourselves to you and to the RISE platform that we've recently set up for Ontario health teams, including those that are supporting the development of these teams over the next while. For those of you on the webinar today, or for those that had joined the webinar on Wednesday that John provided, he described a variety of supports on the RISE website that we believe are going to be important for applicants to use as they go forward. And I know that many of you can also provide supports to Ontario health teams as they progress through this journey. So today we have a variety of brief presentations on 5 topics that really are helping Ontario health teams, those proceeding through application and those in development around some of the key topics that they are learning. And we've chosen these topics, given our understanding from the ministry as to where teams currently might benefit the most in the preparation of both their applications and as they learn going forward. So John and I are going to tag team the presentations today. And just three things to note here. One is that the topics that we're going to talk about today are complex. And it's really meant to set the stage and initial highlights to ground us in some of the key concepts and key considerations as teams across the province move through the journey. And in the upcoming, RISE will host a variety of upcoming webinars in the next few weeks, and we'll delve more deeply into many of these topics. Some of these topics there may be other topics for you that are relevant and particularly for your groups. And please visit the RISE website. There are a variety of other materials up there. And if there are other areas that you think particularly that you could particularly help with and need, please send information to us and we'll work through developing or posting other materials on the RISE website. And then we realize for some of you that your thinking has advanced further on these topics than will be outlined today. And we really do encourage you to share your experiences and your learnings in the discussion period that will follow, that will hold to about 30 minutes. And lastly, I want to just emphasize that the opinions that are expressed today are really of John and myself and the RISE colleagues, and not of the ministry. We have ministry colleagues listening in today and here in the audience, but they won't be answering questions. Rather, please direct any questions around application policy or policy process or policy relevant questions to the ministry directly. Our plan is to evolve these sessions and the learning materials over time, and so your feedback in terms of how we can improve this part of the program of supports for Ontario health teams will be particularly helpful to us today. Okay. Now, I think I want to spend just a couple minutes talking to you about the RISE platform and who we are. My name is Rob Reed, and I'm the Chief Scientist at the Institute for Better Health that's attached to Trillium Health Partners in Mississauga, and I'm also a professor at the Institute for Health Policy Management and Evaluation at the University of Toronto, as well as at the Department of Family and Community Medicine. And as many of you know, before I came to Toronto, I was both a systems scientist in a large integrated health system in the United States, as well as a medical director who led significant change over time. And so I have a lived experience around driving system change in large integrated delivery systems that care for populations. So let me stop now, and I'll let John introduce himself and the rest of the RISE people today.
Thanks very much, Rob. So I'm John Levis, the director of the McMaster Health Forum. I have my colleagues here from the forum, Carrie and Kaylin, and we're very, very grateful to Donna Wilkes, Colin MacArthur, and their colleagues at the Ontario Child Health Support Unit for hosting us today. We have a number of ministry colleagues here, as Rob mentioned, and Karen will be the one who comes up and makes a few comments on their collective behalf. I'm going to jump right in because this session, in terms of the presentation time, is fairly restricted. I'm going to just talk quickly about what we call OHTs 101, and I'm going to talk about the OHT building blocks, talk about the application form that teams invited to full application are working on, and some of the areas of strength and opportunities for improvement emerging from the readiness assessment. If you haven't been to the RISE site already, I'd encourage you to go. There's a RISE brief specifically on the Ontario Health Team building blocks that will give you some of the background. So OHTs 101, this is the biggest transformation of the Ontario Health System that I'm aware of in its history. It's introducing fundamentally new ways of organizing and delivering care that will involve all providers right across sectors and so on. The real emphasis in the early waves are making sure that home and community care providers, primary care providers, and hospitals are at the table, but eventually these teams will need to grow to encompass the full continuum of care. They have to work together in one coordinated team, and they have to be trying to move the needle on the quadruple aim, which means improving care experiences, improving health outcomes, doing that at manageable per capita costs and with positive provider experiences. So this is a tremendously exciting time in Ontario to be contributing to transformation that really makes life better for patients, families, and caregivers. OHTs are going to be clinically and fiscally accountable for delivering a full and coordinated continuum of care to a defined population. So eventually at maturity, instead of budgets going to every organization, the budget will go to a single fund holder and then go out to the partners that are helping to deliver that full continuum of care, and that continuum of care needs to be highly integrated. I've already mentioned that I think this is a landmark development on the same level in terms of its importance as the introduction of universal hospital-based and physician-provided care. OHTs are not going to achieve their desired impacts on their own. None of us know how to do this. Everybody's going to need to learn from one another. And as teams get experiences with new approaches, they're going to, we hope, share their successes so other people can take them up or adapt them, but also be honest about where things haven't gone as well, and learn from one another about how to do things better or differently next time. As part of the Ministry's OHT Central Program of Supports, which you're going to hear about shortly, RISE hopes to be in a position to support rapid learning and improvement by Ontario health teams. If you haven't been on any of the recent ministry webinars, you might not know where we are in this developmental trajectory, but 31 teams have been invited to submit an OHT full application form. They have until the 9th of October for that submission. Those 31 teams are effectively dropping everything and directing all of their efforts to filling out that application form. But filling it out is, in a way, the kind of end result. They are trying to build relationships and so on that will enable them to deliver, and they're trying to come up with very different ways of operating with their partners. So those teams have very little bandwidth for people knocking on their door saying, hey, here's a new idea for you. But if you can find the language that they are using with and that they are using and on the types of challenges they're addressing, and you can provide targeted support, there's a real opportunity for you to have very big impacts on how they approach their team. There are 41 teams that are called in development and in discovery. So these teams, like the 31 teams, completed what was called a readiness assessment, but they all have particular areas they need to be working on in more detail before they proceed to full application. These teams are not under the gun in the same way as the 31 teams because they're not facing a specific deadline that they're trying to reach, but all of them want to be part of this exciting transformation. So they're moving fast, they just don't have that very specific 9th October deadline. 9 teams are exploring what are called innovative models. These are quite different. An example is the Children's Hospital of Eastern Ontario. It's a regional, sometimes provincial asset, and it's one of the 9 teams trying to work out, well, how would we play in this new environment given the role that we play? We're focusing our discussion primarily on the teams that will become a full functioning Ontario Health team and deliver the full continuum of care. The Ontario Medical Association has put together this fantastic interactive map, which if you haven't been to their site, you can use to noodle around. You can look at the green ones are invited to full application. I should get back to our colleagues there to say maybe red isn't the right color for in development because it doesn't mean stop. It's just those teams we hope are still taking a green light to keep pushing. It's just that they're a little bit earlier in the maturation trajectory or the development trajectory than the teams moving forward to full application. So you can use this map to identify teams that are in your region or within easy kind of travel distance if you wanted to work with those teams. When the Ministry of Health first came up with its readiness assessment, they talked about 8 readiness criteria. We've transitioned to language around building blocks simply because we think it's helpful to think about these teams putting in place the building blocks to deliver highly integrated care. So you'll see the language that we use here. We also slightly changed the order in which we describe them. So that's column 1. If you're trying to support Ontario Health teams, it's very important that you know the language of those building blocks and are clear where you can help people with the building of them. The second column then kind of expands the domains within one of the 8 building blocks. So what we've done is we've taken the 8 building blocks, we've carefully read the very, very nuanced advice that was in the guidance document for Ontario Health teams, and we identified the 58 areas where teams would need to make strategic choices. So the middle column are the 18 areas where in the space of integrated care, one would need to make strategic choices. Many of you who can add value to Ontario Health teams can then situate yourself with respect to one or more of those domains. The final column then makes the link between the building blocks and the full OHT application. So if you are going to be helping a team invited to full application, I'd strongly encourage you to familiarize yourself with the application so you know exactly what is being asked of them, and then you can be clear in your offer of support about how you can help them fill out that piece of the application. I've got 2 slides where I'm just summarizing what we have heard in the webinars and other fora where the ministry has talked about the OHT readiness assessment. So this gives you important insights into how you can help teams. So on this slide, there are 3 of the common opportunities for improvement. So many teams can continue to improve how they think about defining their target population. Teams often might have said, we're going to cover this area. But you need to be able to justify that choice based on demographics, cost drivers, and most importantly, referral and utilization patterns. So the ministry has updated analysis by ICES to show referral and utilization patterns. There are 75 to 80 of these networks in Ontario. So teams are now going to soon be getting a map that they can compare to what they thought was their kind of catchment area and now see this new environment. And they'll need to be very specific about what they're covering, which patients they're covering, and what they know about them. Second area for improvement is in the full continuum of in-scope services. So some teams may have come in with partners who were very involved in home and community care, perhaps in hospital care, but teams need to, at maturity, cover that full continuum, and for this stage, need to cover at least those 3 sectors. The ones where more had difficulty with the full scope of services was primary care, not bringing enough of the primary care providers to the table, front and center as partners. Third area where folks could do perhaps even better in the next round as they move forward would be in the area of community engagement. Many of the teams have a lot of experience with patient partnership, but often in terms of community engagement with at least two priority groups, Francophone populations and Indigenous communities, there was sometimes a lack of detail about how that would look. So if you have experience with that type of community engagement, that would be very helpful to teams. Third area, which is the area that's perhaps the newest for most of us in Ontario, is the use of population health management to improve patient care and experience. And this needs to be done particularly in year one for patients for whom the quadruple-aim metrics are particularly poor. And I won't go into more detail on this slide. Rob is going to talk more about this. Next area is digital health enhancements. So along with Ontario Health Teams, the province is very interested in raising the bar in many domains. One of the building blocks is digital health, and it has a lot of aspirations for where we as a health system need to be for digital health. Ontario Health Teams are critically important in achieving those aspirations. So what's going to be key is for Ontario Health Teams to understand their digital health assets and to work out how to enhance them, and most importantly, how to move to full coverage of them. So you might have a pilot project with 10,000 patients that can view their health records through a patient portal, but if your attributed population is 550,000, your coverage with the patient portal should eventually be 550,000. Final area where people will continue to be working is leadership, accountability, and governance. So some of the teams that are in development or in discovery hadn't yet put in place a leadership infrastructure that would allow them to jointly negotiate how they move forward and meaningfully build trusted relationships. Others are a bit further along. They have the leadership infrastructure, but they might not have put in place the beginning steps towards collaborative governance, and I'm going to talk about that in more detail. And as I alluded to before, they might not have been really leveraging primary care capacity and partnerships in their community. So those are some areas that if you work in any of these spaces, there would be a lot of appetite for support to help these teams move farther faster. So on to the OHT Central Program of Support. So I'm going to turn it over to my colleague Karen Liu from the Ministry of Health to talk briefly about the Central Program of Supports, and RISE is nested within that program. Karen.
Hi, thanks John, and hello to everybody who's joined us today. We're really delighted to be at this stage with you and to be talking with you at this first regional session for individuals who are interested in supporting Ontario Health Teams. So before I move to the slide briefly, on the Central Program of Supports that the Ministry is building to help teams, I just wanted to acknowledge John and Rob and Jeremy, who's not here today, for their tremendous expertise and for their ability to very quickly bring together RISE, which is an anchor resource in the supports program. And more importantly, we're here to hear from you about how you can help Ontario Health Teams, and we're really excited to have this group convened here and to see how you can get involved in the RISE network of experts who are assisting Ontario Health Teams. So the Central Program of Supports that we're building is really founded on a number of key principles. The first one being that it's grounded in the Ontario Health Team model itself. And this is really about building the knowledge base and the competencies, helping teams with that are aligned with the components of the Ontario Health Team model that's set out in the Ontario Health Team's guidance document. So RISE describes this as the building blocks, and that is highly aligned with the model as set out in the guidance. The program of supports is also built to meet teams where they are, meaning that we're wanting to bring together experts and bring together the resources that are going to help teams no matter where they are on their readiness journey whether that be in full application or they're in development or they're in discovery teams. They'll have different strengths and challenges. And so we want everybody to be able to come to this program and access resources equitably and find the things that they'll need to help them progress in the stages of readiness. The supports program is also end-user centered and co-designed where possible. Again, we want to make sure that the supports are responsive to teams. They're going to be useful and actionable to teams, and we'll continue to be seeking this perspective from teams as we're expanding the offerings and building the supports. The program will be iteratively developed and continuously improved. We're just at the beginning here in terms of what we're building, and we want to work with you to really expand the RISE network and the range of expertise and local resources that can be provided to teams. And we want to have a mix of general and customized supports that we're providing. So to begin with, the program is featuring a number of general supports that are being made proactively to teams, but as they progress in implementation and maturity, their needs will become more specific. So we're also looking to understand from teams how supports can be tailored to them, and would then, seek the expertise that's in the RISE network to see where we can provide some more tailored supports. In terms of how we're delivering this program, there's a number of core principles. We want to deliver this through a coordinated mechanism within the ministry. So there will be many partners and many hands to successfully deliver this program. So the ministry's role will be to coordinate these collective efforts to make sure that each partner is delivering the type of support that they are best suited to, and that we're facilitating a team's access to the supports that they need. The supports are also going to be delivered by partners with expertise and experience in a defined area of support, but working within a collaborative network. So here's where all of you potentially come in. We know that there's no single organization that can deliver all the supports that are needed for teams to be successful. So we want to convene and bring together the best experts to help teams. And I think the RISE distributed network of experts gives us a great opportunity to do that. Finally, the supports that we want to offer will be made available through various modalities, again, thinking about how teams want to receive their information and support in a way that they can use. So we'll be looking to the RISE network of experts to provide that information, guidance, tools, checklists, communities of practice, all different types of supports to teams. I'll hand it back over to John now.
Thanks very much. So I'm just going to speed it up on my side with these next slides. I won't go into detail about the need for RISE. I'll just focus on that last bullet point that we're trying to use the metaphor, help people drink from a glass. So give them just the information they need at this particular moment, given where they are in their developmental trajectory. The amount of resources out there directly targeted OHTs and potentially relevant to them is huge. It's like drinking from a fire hose, and we're trying to really help them get what they need when they need it. Our vision is a rapid learning system that that achieves the quadruple-aim. That's both at the level of the whole system, but every Ontario Health team is going to be creating its own local health system and will be held accountable for quadruple-aim metrics. Our mission is to contribute to this central program that Karen has described. The ministry has been very consistent in its messages. They want all teams to have equitable access to support across the province. It shouldn't matter whether you're in downtown Toronto, Peterborough, Sudbury, somewhere else. Doesn't matter whether you're an organization with huge amounts of resources or very limited resources. You should have access to the range of the best minds and best thinkers and best practitioners out there to help you be successful. We also want to make sure that those who have expertise, like all of you who are here today, have equitable opportunities to contribute to the support. So our objectives, packages of support like these regional sessions, webinars, on-demand sets of products. So if it turns out we find out there's an emergent need on a particular topic, we'll quickly produce something or work with a partner to do it. build and engage an OHT community of practice, so that's among the teams that are moving forward. But we also want to build a RISE community of practice. And so the folks who are here today who are on the WebEx session, we'd strongly encourage you to join the RISE community of practice. We need to learn from one another about what the challenges are that you're facing in providing support to teams. We want to help you understand what their needs are so you can best match your contributions to what they need at a moment in time. And we've created a one-stop shop in our website, OHT RISE in English, ESO RISE in French. ESO is Équipe Santé Ontario, so the translation of OHT. We'll have a monthly newsletter that starts this month, which you can sign up for. And through the website, I'll point out to you in a minute how we'll point not just to resources we produce, but resources that are produced by partners in the system and by the ministry. So if you go to the Key Resources webpage on the RISE website, you'll see a number of RISE briefs. We currently have 13 of them loaded. So if you're interested in understanding particular features, the big picture, the types of challenges people are addressing and potential ways to address them, you want background that might be helpful to you in your role in providing support, you can go to the RISE website and access those. I'll just point out the three that are underlined. Those kind of go together as a package. Rob's going to be talking briefly about them shortly. And there's a summary sheet, a two-page summary sheet linked to from each of those documents that gives you kind of what you need to know about population health management in a two-pager. Any RISE brief has a box in the top right corner that provides the link both to the relevant building blocks and to the relevant sections in the application to help teams understand how does this help me in my role in designing the building blocks and in my current task of filling out the full application form. If you go to the All Resources webpage, you'll see an expandable menu of the 8 building blocks. You'll see for each building block, we've linked it to the section or questions in the full application. I've expanded the building block for integrated care, so the one about patient care and experience. You'll see that we profile a RISE resource, which is the Population Health Management RISE brief. We've also profiled the Health System Performance Research Network Practice Guide on implementing integrated care. And we've profiled the ministry resource, the jurisdictional scan of select integrated care systems. So that's an example of how we profile both the work we're doing and the work that others are doing that will help teams. For individuals who can support Ontario Health teams, we'd encourage you to read the RISE briefs so you understand what teams need now and will need in the future, and how to talk about how you can help from any of the vantage points that are on here. Some of you might bring research knowledge, others might be patient partners who bring lived experience, others might bring experiential and tacit knowledge. You may have been involved in a bundled care experiment and you have a lot of experience with care pathways. Others might bring contextual knowledge. You've worked a lot in the North and you know what some of the unique challenges might be there. And others might be health system partners like the OHA, the OMA, others who bring much of what I've already talked about, plus delivery mechanism capacity. They might have a coaching infrastructure, a communication infrastructure, or something else that helps them support teams. We'd also encourage you to send any OHT-targeted documents and descriptions of OHT-targeted events to us at RISE, and we're very happy to profile them. So they can be both upcoming, but if you've already had webinars or other things, we can also post events that have taken place along with the recordings of those events. You can join and actively contribute to the RISE community of practice. So when you go to the website, you'll see RISE Exchange. Just click on that, and then you can join the RISE community of practice, and you can join any events profiled on the RISE website, which include both our own and those organized by our partners. We'll have a set of 6 webinars coming up. The first one is on Monday, August 26th, where we're going to dive into more detail on some of the topics that are particularly front of mind for teams going forward. So next one is leadership and governance. So this relates to RISE briefs 2, 3, and 4. Leadership, I'm not going to go into it in a lot of detail. Just by way of background, teams are having to set up a new leadership infrastructure. They're used to running a single organization, and they're now trying to figure out how do we set up an infrastructure that supports 10, 15, 20 partners to collaboratively make decisions, in this case about how to proceed to the full application. They often have an integrated operational management group with the folks who are getting into more of the nuts and bolts about how things will actually work, and they often have working groups focused on particular priorities, and I've given some examples here. They very often have work plans. We've developed a prototype work plan or suites of work plans that teams can adapt if they find helpful, but that might also give you clues about how you could add value. Collaborative governance is a new concept for many of these organizations. We have a long, rich tradition of governance of independent voluntary boards involved in governance in Ontario. What we now have to move toward is a model where leaders from those organizations from multiple sectors are collectively making decisions in ways that are deliberative, consensus-oriented, and directed to the achievement of a shared goal, in this case, quadruple aim. So in the old days as a board member, I focused on what was good for my organization. I now need to be thinking as a board member, how do I make sure that we are aligned to this broader team so that we collectively improve care experiences, improve health outcomes, keep costs manageable, and keep providers satisfied. 3 possible steps: the written agreement, making sure boards are making the right decisions to align themselves with the team, but the most important is the trusted relationships. These are tables where you might have a hospital CEO with a budget of $1 billion who might not have historically treated community partners well, with a lot of small community partners, some people representing a family health team. It's a very different landscape. People bring a lot of history to that. And from our perspective, the priority in the coming year has to be building those trusted relationships so people can work together. And in some cases, it's rebuilding relationships that might have had challenges in the past. Primary care leadership is likely going to be essential to the success of Ontario health teams. We've just outlined here from the brief 3 things people can do. Help the full diversity of primary care providers understand Ontario health teams. So there's folks participating on the webinar on WebEx from some of these organizations that are doing superb work. They already have well-established relationships with and a rich history of supporting different types of providers. So they're a hugely important asset. We can also be supporting primary care providers to become leaders in their teams. And again, we have a number of initiatives in the province that are specifically targeted at supporting the primary care leaders that will be essential in teams. And you and teams themselves will have to work with those leaders in their local communities to encourage the active participation of primary care providers. And I come back again to the same key message from the last slide: trusted relationships. Many primary care providers are quite isolated from some of the bigger institutions in their local communities, and for them to play meaningful roles as full members of the team, trusted relationships are going to be absolutely key. So I'm going to turn it over now to Rob for a quick run-through of population health management.
Thanks, John. Population health management is probably one of the biggest changes that will have to occur in the implementation of Ontario health teams in the province. It really changes the mechanisms and delivery of care in fundamentally different ways. And this is going to challenge teams across the sector to do this. This is an area where support can be particularly useful in helping teams along this journey. Just to anchor people that are familiar in the concept of population health management, there's a brief on the RISE website about this, but it's really around the proactive management of health and health care for a defined population. Defined populations are not commonplace in Ontario, and we are introducing the notion of attributed populations that are defined, that we're holding Ontario health teams accountable for. Underpinning the concept of population health management are 4 things, at least in my experience, that we're trying to anchor teams in to make sure that they keep these in sight at all times. The first is the concept of population, and it's focusing not only on the people who use the system, but also the people that don't, and understanding in a much more thorough way about what the spectrum of people are across populations and what that spectrum of needs are. Okay. Second is about the concept of being planful and proactive in their care delivery mechanisms. So it's about proactively filling care gaps, connecting and coordinating care over time proactively, and about making sure that we're reaching out to people who have fallen through the cracks in a proactive management. Another core concept of population health management that is not commonplace currently in most places in Ontario. It is about addressing health inequities that relate to socioeconomic determinants of health that interfere with care seeking and care self-management behaviors. And it's about building confidence and equipping patients, and it's about removing barriers. And then fourth and fundamentally, and I probably don't have to say this to this audience, it's fundamentally about being patient-centered and not disease-oriented. A shift in thinking among many places in Ontario. It's about addressing the complement of person's need across a population and engaging in that care. Okay? So it's, this is very simple to say, for me to get up and talk about. It is extraordinarily complex to change teams' thinkings about these concepts and to actually deliver on these tenets consistently. There's a few things that are going to be absolutely essential to the population health management journey, and one is the actual segmentation of patients, of populations. We know that successful experiments across the world, we really have to ramp up on this whole journey to segment in subpopulations that we can actually move the needle on. And so realistically, we can't start with full populations, so we have to focus, reinvent care, a few pathways at a time, and gain some momentum across these teams to move to broader and bigger issues across populations. The ministry has given lots of leeway around for teams to define their subpopulations and are focusing, and teams right now are focusing on selecting those subpopulations for activity in the Ontario Health teams. And they're making decisions based on potential impact around the triple-aim, what's the opportunity for improvement, but on things like having the right partners at the table and making sure that the redesigns that they're contemplating are actually feasible and will likely succeed. After selecting the populations, what's really critical for teams to do is now really reinvent care based on existing evidence that's there, but also contextualizing it and using it in new modalities, particularly with patient and family and community co-design activities, which many people in this room are expert in. So I think that you will play a significant role around co-design and actually how that actually occurs. Particularly with the use of new information technologies and digital health, we have a lot of ways to reinvent how care is actually delivered to populations, and that we can actually move in that direction. When redesigning care for persons and people in a population, we're also really focusing on making sure that we're being proactive and patient-centered in that redesign. And that's including both in-reach and outreach services. So that in-reach services is making sure that we're addressing the complement of patients' needs when they're seen, regardless of the partner organization that they come to. So for instance, if a patient is seen in a hospital ambulatory clinic for a cardiac procedure, we're making sure that teams think about the other care needs that are also needed at that time, such as colorectal cancer screening and flu vaccination and so forth, okay, across that journey. The second is outreach services, and there's a lot of expertise in this area about features that we can actually reach out and actually manage patients' populations, particularly hard to reach populations that have a variety of different access barriers to receiving their care. Planned care pathways, clinical decision support systems, and care coordination mechanisms are also important in this whole area of population health management, and there's a tremendous amount of expertise in this province around many of those things that we will look to you to help fill those gaps. This is just a slide that we've been using about population health management. I encourage you to look on the RISE website. It talks about the philosophy of population health management and actually the curves around that teams have to consider across their full populations. I won't go into any detail. The next thing around population health management is clearly around data analytics and research evidence. We are really reinventing care in dramatically different ways, and we need expertise. Teams need expertise on identifying and understanding what problems are, the expertise around co-designing solutions, around actually rapid cycle evaluation and implementation science, and clearly about how to determine whether things are working or not working, and evolving their journey. Finally, there's a variety of principles here that have been drafted around to help guide care teams through this journey of being really patient-centered and population-based. And it's about improving care experiences and health outcomes. It's about making sure that we're using all relevant resources from our all OHT partners that have not historically been involved in that circle of care. And it's really reinventing care in different ways and different roles for different partners. Okay? I won't go through this for anymore, and I'm going to hand it back over to John.
Thank you very much, Rob. The next one is just rapid learning and improvement and how a community of practice can help. In the interest of time, I'll just say to you, keep in mind that teams that are moving to full application are trying to do two things. They're trying to design and build the building blocks, and they're trying to use those building blocks to improve care experiences and health outcomes for their year one priority population. So they've got kind of two different strands of work. In both of them, rapid learning and improvement can help. You just saw a slide that had the first four of these steps in relation to population health management. Community of practice, we think, can be hugely helpful here. I mentioned before we have a community of practice for the teams. We're hoping that we can support a community of practice among folks like yourselves who are in turn supporting these teams. And we think we have a lot to learn from each other about how we can bring our respective areas of expertise to the table. So concrete example would be, I went from, I now realize, knowing less than nothing about population health management to now at least being able to have a conversation about it because of my interactions with Rob. Ontario sits on an absolute treasure in terms of the vast riches of the experts in this province. They're distributed across the province. They have many different areas of expertise, and we're hoping that those experts will create a profile on the online platform and then start to contribute to the conversations. You can weigh in on a general topic, OHTs in general. You can weigh in on a particular building block. If you're more comfortable in French, you can go into the French interface, or you can ask us to set up a group that might be regional or could be focused on a subgroup. And if you want that, then just send an email to us at rise@mcmaster.ca, and we're happy to set that up for you.